Okay, today we have a topic, first aid. First aid is very important for everybody. If we are trained, we know about the first aid, then we can help to our workers, our colleague, and also in our family we can help. But if we are untrained, we don't know about the first aid, then we cannot help to other people. But this first aid is very important for our special workers, because inside the plant several accidents happening. But if we are trained, we know something, and then we can help to our people. Now we are giving some example. If anybody take a shock by electricity and is unconscious, first we try to control our electricity. If near us we have a main switch or other any device, we try to control, we disconnect the electricity, and then we try to take that patient. But if the electricity is also going on and we not off the switch, and we directly, if we try to take the victim, then also not a one, also we are arranging more patient, also we are then two. But we try to first disconnect the electricity and then we hold two guys. And if he is unconscious, then first we try to his breathing system try to start, and we have a three method, but first we try to basic and simple way we have. Then in mouth to mouth we are starting to breathe to that guy, and first we push breathe 2 times and 15 times we press his chest. And if we 15 times pressed and 2 times we are giving to this one, and continue we start to this one, and then maybe that guys also start again breathing. But if we are not doing this one, and we are not help to that guys, maybe after 5 minutes, 6 minutes, that guys maybe died, because this is very important thing. Breathing we must be stopped. But how we check? First we see any guys is unconscious, take a shock or anything, then first we check, we keep our right ear is upside the mouth, and we also look his chest, and we feel also by face, and also we are looking to chest, and if he is breathing, and then we know okay, he is okay. But if he is not breathing, he is not also feeling anything, then we also try to first we ask to him, Mr. Hello. If he not listening to us, then we understand, oh, this guy is unconscious, then we start his also breathing system. And if his heart is not working, his pulse is stopped, then we also punch at the heart, and if his pulse also start, then we understand, okay, this guy is now okay. And this one is basic thing. We have this system called CPR. And if anybody have a cut, if the bleeding, especially the guy is also working inside the plant, they are cutting his fingers and sometimes coming small cuts. First we try to control the bleeding, and first we tie by hand. If the more cut, then also we have one system. If we keep our cutted area, for example fingers, and if the coming blood, we keep this finger upside our head, and when we keep upside, then this blood also stops, because our heart is working only in our body. If we keep any cutted area upside the body, then bleeding also we can control. And otherwise we also tie that area, and also we hold, and we also control by this. And if anybody bone broken, then we also giving the support. If we have a other shirt or anything or any handkerchief, we tie by the normal cloth, and also we give the support to his arm or legs or anywhere, and then we are only first aider. We are giving temporary base some help, and we are giving help to only before the doctor and patient we are sending to hospital. This thing is during this time we are doing some help. This help is called first aid. And Also, if the somebody, in this desert area, also we have several things. Now in this area also, before we found in our area snake, and this snake is also dangerous. But snake, in the all over the world, 80% snake, they are not too much dangerous. They are poison, but less poison, because we not say these snakes are very dangerous, but only 80%. But 15% snake are dangerous, but they are not more dangerous. But 5% snake is very, very dangerous. And but if anybody affected by snake, snake bites, then we inform to that guys, oh baby, this snake coming in 80%. Because if the guy is afraid, then maybe he afraid and die. But we first control to this thing. We inform to that guy, oh no problem, mister, oh this one is only coming in 80%. But the first aider, he must be thinking about this. This snake may be in the 5%. Must be we arrange the first aid. If we arrange the first aid, then first we also cut to that area, and after that, first we cut that area in vertical. And when we cut to that area, and after that we also press to and also tie in single bone. First we tie, and then after that we also clean to that area. And if we have some antibodies which can use, otherwise we also clean and arrange the bandage. And after that we also try to that guys cannot sleep. If he sleep, this poison also affect at the brain. If the guy is sleeping, then after that this one is more dangerous. If we control to this thing, then we are also help to that guys. And other thing, if some places there have dogs, if anybody affected by dog, and dog also cut to anybody, then we are also immediately we clean to that area by soap or Dettol or spirit or anything if you available. If we not found anything, but soap is always we can found easily, and soap have a soda caustic, and this caustic immediately kill to these are germs, and we try to immediately clean and thoroughly clean to that area. If we are feeling we not control to this thing, and immediately we cannot control to this area, and we not clean to this one is more dangerous. And also you see this one, if we are looking to this one, okay, we are doing this treatment and we are sending to hospital, but immediately we not take action, then these diseases also coming in the affect also this dog also disease coming into brain. And after that